Welcome again to these few MCQs. There's a MCQ video series. I'm Doctor Ankit, Professor Anatomy and Anatomy faculty at LNX platform. Let's start the MCQ. So here's the first MCQ. Remember, we have to do around 10 MCQs. So first MCQ asks 45-year-old patient presents with a vague abdominal pain and undergoes CT of the abdomen. Which of the following labeled organs is supplied by an artery of the foregut, although it is not a foregut derivative? So here is a very important conceptual question. If you look at the last line of the question, which organ is supplied by an artery of the foregut, although it is not a foregut derivative? Which is the artery of foregut? Artery of foregut is celiac trunk. Celiac trunk will supply an organ which is not a foregut derivative. Celiac trunk supplies foregut, but it also supplies an organ known as spleen, which is a lymphatic or a lymphoid organ coming from mesoderm, not a foregut derivative. So we have to identify the spleen in this particular CT. Okay, looking at a CT, right side, left side, anterior, posterior. Spleen lies on right or left side? Left side. Very good. Spleen lies on left side. We have options like A over here, B, C, D, and E. Only one option going to the left side. Answer over here is option number E. Looking at other options, A is probably our liver over here, right? B is the kidney over here. Which side? The right kidney. Okay. C would be a parts of gut. C and D are parts of gut or the intestine, and E over here is the spleen. Hence the answer is option number E, that is the spleen. Got the point? Beautiful question. Okay. So remember, the organ which is not a foregut derivative but supplied by the artery of foregut is spleen. It's a mesodermal derivative. Next question. You are an intern posted in the PDR. You are asked to go to the delivery and do an ABGAR score. I hope you remember the full form of ABGAR, 5 parameters at 1 and 5 minutes. While evaluating, you notice the following deformity in the baby, as in the image over here, primarily caused by. So what's the deformity? You can see that lower lip is not completely formed in the center middle. Lower lip, therefore, is formed by which structures? Development of face. The lower lip and the jaw are on both the sides are formed by or fusion of the mandibular processes, which is for first pharyngeal arch. They have to fuse in the midline. If they don't fuse, the picture appears like this, which is rare actually. Answer over here is ABCD, non-fusion of two medial maxillary, option number 4th, or the D option, non-fusion of the mandibular processes. If we take a look at the development of face over here, look the lower mandible or the mandible and the lower lip by the mandibular process. If you look at the other things, looking at a face over here, the red color over here is the maxillary process. The blue color is, the yellow is medial nasal process. The blue color is lateral nasal process, remember. Upper lip is formed by medial nasal process and the maxillary process. Okay, right. Here we have some other anomalies which you can see. This is quite common. I hope you recognize, that is unilateral cleft lip, non-fusion of maxillary process and medial nasal process on one side. The same thing over here, bilateral cleft upper lip. Over here, cleft lip plus cleft palate. Here we have cleft palate, and here we have in this option, it is non-fusion of maxillary process on the sides with the lateral nasal process. And this is known as oblique facial cleft. Oblique facial cleft. Cleft mandible or cleft lower lip already you have seen in the question, right? Fair enough. So here it was the question. Now coming to the next one, the third question over here. The following CT shows a left crescent shaped extraaxial hematoma. Crescent means moon. Indicated by the arrows. You can see the arrows. The hematoma is appearing somewhat like this. Okay. Compressing the brain of a 17-year-old lady who impacted the front of her head on the steering wheel during a head-on motor vehicular accident. Given the radiological imaging results and the history of the accident, what blood vessels are the most likely source for the cerebral hemorrhage? So, look at the CT image. It's covering half of the skull. It is crescent shaped. The mode of injury is hitting the front of her head on the steering wheel during the accident. What blood vessels? What type of hemorrhage it is? Is it epidural hemorrhage or subdural hemorrhage or subarachnoid or something else? It is appearing more like the subdural hemorrhage, looking at the shadow and the history. Epidural hemorrhage is actually more of a biconvex. Epidural hemorrhage is more of a biconvex shape and particularly smaller in size, and mainly the pterion over here on the sides with H-shaped suture that is damaged, leading to rupture of the middle meningeal artery. Subdural hemorrhage is a venous bleed and is probably caused by rupture of the veins, right? So here, if you look at the options, only option number D is telling us about the superior cerebral veins, and hence this would be the answer, because it is actually the subdural hemorrhage, not the epidural hemorrhage. Okay, if you look at the differences over here, okay, this actually is showing us the epidural hemorrhage picture, smaller, right? And this over here, which is spread to the half, that is a subdural hematoma or subdural hemorrhage. The subdural hemorrhage are basically, these are the venous bleed, and epidural or extradural hemorrhage are basically arterial bleed. If they are arterial, they are venous bleed. Remember these basic differences. Fair enough. Okay, let's move to question number 4. A patient presented with abdominal distension. The patient admits to drinking 10 to 12 beers a day for the last 20 years. On examination, his abdomen is distended with engorged paraumbilical veins. Think about the organ. There is also power erythema and multiple spider angiomas are present. Before beginning the patient's treatment, which of the following structures labeled on the image below is expected to have an increased pressure? This whole is liver. It's probably a case of portal hypertension, showing also the alcohol history of alcohol intake. In portal hypertension, obviously it's actually the liver that is damaged, leading to increase in the pressure of portal vein. I was asking you which have increased pressure. We know theoretically it has to be portal vein. So do we have to search for portal vein in the image over here? Probably yes. Let's look. I'm sure you can see ABCD. A over here, B and C and D. That's right side, left, posterior and anterior. This is a vertebrae over here. In front of vertebrae, what are A and B? A is probably to the left side. A is the aorta, right? B is to the right side of midline. B should be IVC. C is going inside the liver. Where is the liver? This is the liver. And C is in front of IVC. C is the portal vein. C is the answer. Okay, D is a branch of aorta. Probably could be a superior mesenteric artery. Over here, the answer is option number C. That is a portal vein over here. This is the answer. Option number C, the portal vein. Was asking about the increased pressure. Looking at a similar picture over here with the particular labeled, you can very well see the IVC. Okay, we can see a few structures over here, the IVC, the aorta. Look at the sides. In front of IVC, okay, we have the structure portal vein already labeled over here, right in front of it. Then we have the GB for gallbladder, we have the kidneys, K, okay, we have the SP for spleen, left side, we did a question on it. And also, you can also see the pancreatic head. Here you can see the head and tail of pancreas. So this is the tail of pancreas, that is the head of pancreas, that is the head of pancreas. Okay, some labeled structure over here, also the splenic vein. You can see the splenic vein and the formation of the portal vein. Because portal vein is actually formed by the splenic vein plus superior mesenteric. Fair enough. So this is the 4th question. Let's move to the 5th one. A 16-year-old boy making a powerful move out of the starting blocks to begin a 100-meter sprint feels intense pain below his right knee and collapses to the ground, unable to straighten the leg. Okay. The given film of the lateral knee reveals an avulsion of the area indicated by the arrowhead. This is the arrowhead. Avulsion occurred over here. Okay, with the fractured fragment identified by the white arrow. So this is the fractured fragment. That is a fragment over here. Which of the following muscles is most likely detached? They are saying that avulsion happened from here, right, and it moved to that side. Okay, what is the structure over here? It's a lateral view. We can easily identify the P for patella, F for femur, and this is T, B and fibula over here. What is the structure which is going from femur to tibia anteriorly? Plus, they also give a hint unable to straighten the leg or unable to extend the knee. Which muscles extend the knee? Think about it. It's the muscles in front of the thigh which are known as quadriceps femoris muscle. Do they go to patella? Yes, they go to patella. From patella, where do they go? They go to tibia. Fine. Via patellar ligament. This is probably looking like a rupture of patellar ligament. Okay, a bit of boning also, because this bone is avulsed from the tibia over here. It's attached to tibial tuberosity. Now they're asking you that which of the following muscles is most likely detached. It is the muscle of quadriceps femoris. Quadriceps femoris has 4 muscles, quadri, right? So one recti femoris, and you have vastus lateralis, vastus medialis, vastus intermedius. Out of these 4, one should be in the option. Let us search for that. Straightforward, right? Option number D. If someone tomorrow asks you what is the nerve supplying this particular muscle, remember all these 4 muscles supplied by femoral nerve, because femoral nerve is the nerve of anterior thigh compartment. Right? Look at this image also, anatomy. This is what was in the question, patellar tendon or patellar ligament coming from quadriceps over here, quadriceps muscles, going to this tibia. So this part was avulsed. Okay, remember this. Okay, so moving from this 50% battle over. 6th question. A physician performs some simple muscle test on 35-year-old patient when he complains of weakness in his lower limb. In the physical test illustrated, the patient is asked to touch his buttocks with his heel. Asked to touch the buttocks. Buttocks are probably lying over here. B for buttocks, heel, okay. While working against resistance, fine. So resistance is being given in this direction. What muscle group is being tested? So basically, the patient is being asked to do a force in this direction against a resistance in this direction, right? Force is in this direction. The movement is occurring at which joint? The movement is occurring at the joint, that is the knee joint. What movement? Basically knee flexion is being occurred over here. Which muscle causes knee flexion? The muscles which are lying over here. These muscles cause knee flexion, and these are the posterior thigh muscles, also known as hamstring muscles. If you look at the options over here, the question they are asking is what muscles group is being tested. It's a hamstring muscles, the posterior thigh muscles. Okay, quadriceps femoris are lying in the anterior thigh, adductors in the medial thigh, triceps suri are actually 3 different tendons over here. That's a different thing, but yeah. Now look at the image over here. Clearly tells us flexion at the knee done by the flexors or the hamstrings. Okay. Now which nerve supplies them? Hamstrings. Basically they are semitendinosus, semimembranosus, and our biceps femoris. The nerve that supplies them is the tibial nerve. Okay. Fair enough. Coming to the 7th question. A young man suffers a dislocation of the right hip. Okay. During recovery, he finds he has an abnormal gait, in which his left hip sinks when he lifts that foot to take a step as shown in the right frame C. The problem may be result of damage. So injury of the right hip, but actually the left hip is sinks down. I hope you all are aware of the Trendelenburg's gait or Trendelenburg sign over here. Injury was to the right hip. Now see what happens is we have a muscle over here known as the gluteus medius or minimus. They are the abductors. So when the right foot is on the ground, these right side gluteus medius contract and they pull the pelvis on this side like this. So they lift the left side of the pelvis. Now that is normal. But if the right side gluteus medius minimus, they are paralyzed, minus, not working. Okay, minus means that they are not working. Then what will happen is once the right foot is on the ground and the left foot is taken off from the ground, this right side gluteus medius minimus is not working. Medius and gluteus minimus, they are not able to tilt the pelvis in this direction, so pelvis will drop down of the left side, that is of the normal side. This is the abnormal side. So problem is in the right side, but the left pelvis is going down. So they asked the problem is due to damage where? It's in the right side. So rule out B and C option. Right, not maximus, it is right gluteus medius. Okay, And the nerve supplying the gluteus medius is superior gluteal nerve, another question. The nerve supplying the gluteus maximus is inferior gluteal nerve. So first of all, clear the side and then the muscle, Trendelenburg sign. Look at this image. The image tells us the same thing. This is the normal picture. Okay, that is a normal picture, and this is the abnormal picture. Okay, fair enough. Fair enough. So coming to the 8th question, what lies directly above the tentorium cerebelli? Tentorium cerebelli is actually a dural fold. It's a dural fold between the cerebellum below and some structure above it, because it forms a tent over cerebellum known as tentorium cerebelli. So they're asking you what lies above the tentorium cerebelli. Okay, in this image, I'm just zoning it. This is the tentorium cerebelli (TC), and this is the fox cerebri. Okay, so below tentorium cerebelli we have the cerebellum. But what lies above it? Think about it. Imagine yourself in your heads about a section of the brain. Imagine here you have the cerebellum, and this is the location of tentorium cerebelli. Okay, this is the location of blue color. Imagine it is tentorium cerebelli. Now think about what structure is this. Posterior lobe of the cerebellum, that is occipital lobe. Yes, occipital lobe is the answer. I'll show you an image. Let's see an image over here. It's a posterior view. The image over here is a posterior view. Look at the tentorium cerebelli over here. Look at the tentorium cerebelli. This is all over tentorium cerebelli, which actually houses the transverse sinus. Okay, below tentorium cerebelli we have the cerebellum below it, and above it is the structure. What structure? I highlight occipital lobe, hence the answer. Okay, this over here in the midline is the fox cerebri. That's also important, and that houses the superior sagittal sinus, and also it houses the inferior sagittal sinus as well. Right, so important topic is dural venous sinuses and dural folds. 4 dural folds are there: fox cerebri, fox cerebelli, tentorium cerebelli, and diaphragmatic celli. 4 dural folds. FCFC is cerebri and cerebelli. Right? Okay. Let's move to the 9th one. What vessel supplies this gyrus? Now, these questions might look a bit smaller, but they can give a good complete clinical situation, and the zest of the question is this only. Question is, what vessel supplies this gyrus? Which gyrus? The arrowed gyrus. Where is the arrow? Here is the arrow. Which gyrus is this? Think about it. Which gyrus is this? This is the gyrus above the callosum, above the corpus callosum. This is the cingulate gyrus. So if you remember, in the previous sessions we did a question on the cerebral angiography. Which cerebral artery lies in the medial side, on the medial surface of the brain? It is anterior cerebral artery. Very good. So anterior cerebral artery runs like this, and it gives off branches. Hence, answer has to be anterior cerebral artery. Is that an option? Yes, it is. Option number A is our answer. If you look at this image, though it's a mirror image, you can see this anterior cerebral artery. This is corpus callosum. Okay, and that was actually marked. That is a cingulate gyrus over here in the question. Fair enough? Okay, coming to the last question of this particular session. 82-year-old lady develops a dural meningioma that compresses the confluence of the dural venous sinuses. We did sinus over just in the recent question. On the given contrast from an angiographic series, drainage from which of the following labeled vessels would be impeded by the tumor? See, the tumor is at the confluence of dural venous sinuses. We look at an image. Let me draw a bit for you guys. If this is the anterior side, that is the posterior side. This is superior sagittal sinus. That is inferior sagittal sinus. Here you have the great vein of Galen, G for Galen, and they all combine to form the straight sinus. Other point is the blood is flowing in this direction. There is also a small sinus coming from below known as occipital sinus. Now what happens is all of the blood over here meets over here, and that location is the confluence of sinus. This location actually is the confluence of sinus. they are asking that there's a tumor which is developed over here. So there's a tumor over here that will impede drainage. It will impede drainage of superior septal sinus also, inferior septal sinus also, straight sinus also, and occipital sinus also. Can we see any of these in the figure? We'll see. Before going to that area, let us understand if we can make over here that in the normal case, from the confluence of sinuses, the transverse sinuses run on the side, TS. And these continue as a sigmoid sinus. And they are connected in front by the cavernous sinus. And in turn, the sigmoid sinus finally continues down as the internal jugular vein. It continues down as the internal jugular vein. You'll see in the image. First, I look at the image actually. That will be more beneficial for understanding this question, anterior and posterior. Okay? Now, focus on the areas which I am highlighting only. Don't focus on all the things. And look at superior septal sinus. Then look at the inferior septal sinus. They are present medially. And also look at the straight sinus. And they are meeting over here, the confluence is over here. From the confluence, the two transverse sinuses are running on the sides. Remember, at the posterior border of tentorium cerebelli. These transverse sinuses joined to form sigmoid sinus, or they continued at the sigmoid sinus, which went down as this internal jugular vein. And the sigmoid transverse is connected via cavernous sinus through these petrosal sinuses, like superior inferior petrosal sinuses. These are the 5-6 important sinuses you should know. Now we all know that we should be searching, because they are asking for if there's a tumor at the confluence, which sinus will be, which drainage of which sinus will be impeded. So we have to search for superior septal, inferior septal, straight, or occipital. If you come back to this image over here, option number A, this is superior septal sinus. It is the answer, but we'll see more. This is the answer over here. Option number A is the answer. Option number B over here, this is from the tumor. There's a tumor location over here. Option number B is probably the transverse sinus, B. Okay, then this over here, if I correctly try to figure out, this will be the sigmoid sinus. This C over here will be the cavernous sinus. This D will be the superior petrosal sinus, and E will be the inferior petrosal sinus. But the drainage will be impeded only in the superior septal sinus. Hence, superior septal sinus will be our answer. Very good question. Try to remember it. Remember this image. I hope you guys are enjoying. So that's all for today's session. We'll come with more important topics, more important MCQs. Thank you. All the best.